Kangaroo care offers a privileged contact between the parent and the baby. It creates a comforting environment whose several elements recall life in the mother's womb: heartbeat, breathing, noises of digestion, smells and familiar voices, etc. Even if it reminds your baby of his uterine life, kangaroo care is just as suitable for fathers. To illustrate this care, we have the parents of Tristan and the mum of Azael. Before, prepare the environment, if possible, with the help of the nurse. See if you can close the blinds or dim the lights, for example. Or you can place yourself away from other surrounding light sources such as bedside lights or phototherapy lights. Be sure to speak in a low voice. Adjust the room temperature to be comfortable. Prepare yourself and your baby. Place the blanket and hat in the incubator 5 minutes before the kangaroo care session. If your baby is in a small crib or bassinet, this precaution is not necessary. Wash your hands and make sure that the skin of your chest is clean and unscented. Remove your jewelry to promote optimal contact and protect your baby's fragile skin. Remove your shirt or top and put on a hospital gown. You can also keep your clothes and only lower your top when your baby is placed against you. Moms should take off their bra. As for dads, they should avoid shaving their chest hair. The baby will be able to grasp them to secure him or herself. If your baby is wearing pajamas, remove them. He or she should only wear a diaper. During this stage, be sure to keep the baby as much as possible in the fetal position, arms and legs flexed, hands near the face. Positioning your baby on their side will help them stay in this position. It is more stressful for the baby to be on his or her back in an open position. Put a hat or a small toque on your baby. In the case of baby Azael, he already had his little toque from his breathing tubes and a blanket swaddled him. During, check with the nurse to find out how to do the transfer. There are 2 options. You are given your baby while you are already sitting, or, as in this case, you will pick them up from the incubator or crib. To take his baby into kangaroo, Tristan's father helps the nurse to position him according to the methods of the transfer. This refers to leaflet 8. Once moved, both parents take the time to see if Tristan tolerated the transfer. Mom looks at him gently with tenderness. It is important to respect the principles of the transfer and carry methods. This refers to leaflet number 8 and number 7. In the case of Azael, who is in an incubator, his mother leans towards him as much as possible in order to pick him up while the nurse helps with the tubes and wires. Mom takes the time to look at her son to see his reactions following the transfer, and she moves back and sits down gently. Once she sits down, she looks at him again to make sure he's calm. Following the move, Azael reacts a little with facial grimacing and extending his hands. Mom, looking at the monitor, ensures that his vital signs remain stable. Thus, although he showed signs of stress, he didn't become too disorganized. The nurse tilts the zero-gravity chair and looks after the comfort of both Mom and Azael. The zero gravity chair is ideal since it allows an optimal inclination for your greatest comfort and that of your baby. Tristan's mom installs him vertically, while Dad makes sure his son is well placed and the wires are okay. The nurse brings her a blanket and Dad readjusts the cushions to increase Mom and Tristan's comfort. Azael's mom wears her baby more to the side to promote eye contact with her son. In both cases, the cover offers them warmth and containment. The cover can also be your hospital jacket or a kangaroo tube. Enjoy these moments with your baby. Azael's mom takes the time to observe him. This is important since a baby may have a delayed reaction to transferring due to the immaturity of their nervous system. After making sure that Tristan does not show any signs of stress, Mom starts talking to him gently. Mom presents him with one stimulation at a time and checks to see if he tolerates it well. Kangaroo care should usually last a minimum of 60 minutes for your baby to reach the deep sleep phase. This sleep phase allows him or her to recover well and to grow. To make the most of the contact with Mom, Azael receives her gavage during this time. Tristan's mom gently slid him onto the breast to give him an enjoyable experience. Nestled against Mom, Tristan can smell and even taste breast milk. Mom talks to him and Tristan responds by opening his eyes, which is a sign of adaptation. After. Use the transfer and carrying methods used at the beginning of kangaroo care to return to the incubator or bed. Take the time to tell your baby that kangaroo care is over, if he or she tolerates it well, obviously. Be sure to apply the methods of returning to calm for the next few minutes to give your baby the time to reorganize and fall asleep gently. Remove your hands gradually so that your baby always feels contact as he relaxes and falls asleep.